Good evening, everyone. We start with a question. Is racism a public health crisis? The Hennepin County Board says it is, and it said today that due to racism, Black, Indigenous, and people of color in Hennepin County have just suffered deep disparities. What kind? People in those groups in this county very often earn less money than whites, don't get the same education quality, and don't always have access to decent health care. And it isn't just the Hennepin County Board saying this. Some doctors in this state are speaking up as well, saying publicly they believe racism is a public health crisis. Here's Sharon.
As a pediatrician and internist, Dr. Mike Aylward sees public health up close.
We know that there are facts of the matter, and those are that our Black communities, our Indigenous communities, our brown communities have shorter life expectancies, have increased rates of cardiovascular disease and cancer and obesity and diabetes.
But as the president of the Minnesota Doctors for Health Equity, Aylward also sees the bigger picture behind why these facts of the matter are facts of the matter.
Racism both directly impacts people's health based on the actual stress of racist incidents, but much more powerfully, it's the structures, the racist policies that lead to these other factors causing health issues.
He's talking about systemic inequalities that lie in housing, access to transportation, food deserts. Given all this, MDHEQ urged state leaders to declare racism as a public health crisis.
Is there something specific that prompted you guys to put something out?
Reality that health disparities are an issue in Minnesota is not a new one, but with COVID being as prevalent as it is, specifically the Black community in Minnesota, or in Minneapolis particularly, and then with the murder of George Floyd and all the protests that were going on, it became clear that racism is, a significant health issue.
You guys sent a press release.
Yep.
So what?
I think you could argue that everybody needs to play a role in this, especially, from teachers to people working in housing. But for us, it's really about physicians and health professionals using their voice and using our power and privilege to make change. But also, the government needs to be involved in terms of going through policies and eliminating racist policies and having an anti-racist approach to everything.
Aylward says he's hopeful that having elected officials declare and recognize racism as something that's systemically affecting public health, that would lead to a broader consideration about who the system currently serves and who it doesn't.
There's a law, if there's a policy, if the health system is making a decision, they necessarily have to be including the people who those decisions most affect. And if they don't, there's a high chance that it's going to be a policy that exacerbates inequality.
If you're curious about that Minnesota Doctors for Health Equity organization, they're a group that represents physicians all over the state. They're made up of 9 Minnesota doctors organizations and represent more than 5,000 in the field in Minnesota.